Okay, good evening, everybody. I would like to call the meeting to order. We have a busy agenda tonight, so we'll try to move through it expeditiously here. So first of all, on the agenda is the approval of the previous minutes from September 25th, 2024. Do I have a motion to approve those minutes?
I make a motion to move minutes.
Second? Second. Okay, all in favor?
Aye.
Okay, Carissa?
Aye.
Oh, thank you, Carissa. All right, and let's see. Okay, so the next item here is,
Guest speaker.
sorry, I'm on the wrong thing there. Okay, we have a guest speaker for the nicotine-free generation. And this is Maureen Busby.
Yep.
Sorry. And I hope everybody knows what the nicotine-free generation is intended to mean, but Maureen, you're going to describe it to us anyway, I hope. So,
Absolutely.
So I'll introduce Maureen, and for those in attendance and those watching from home, I also want to remind people that the meeting is being audio and video recorded. If anyone in attendance on Zoom or in person feels the need that they don't want to be recorded, they're more than welcome to leave if they do so. And after the meeting, the recording does go to public access for all those of you. So I would like to introduce Maureen Busby, who's the Mystic Valley Regional Tobacco Program Manager, who's one of our counterparts across the state. As everyone knows, we've been funded for the last 30 years for tobacco control, where we really try to advance equity, reduce access to youth and young people from smoking, vaping, and others. And we provide a lot of technical assistance through many boards of health in Berkshire County. And Maureen is very active on her side of the state. And the intent is to introduce Maureen for a very short introduction, to be mindful of her time and everyone else's time. And she's been pushing and others in the eastern part of the state, the new concept of nicotine-free generation. As we all know, we have a hard time competing with big tobacco. They spend billions of dollars a year in advertising, marketing, and trying to get the next generation hooked. Nicotine-free generation is a concept where boards of health have local authority to actually change policy at the local level, where we set a cutoff date, and anyone under the age of 21, before they turn 21, will never be able to purchase tobacco and nicotine, where it's a transition to really weed out addiction and use over a long period of time. It's caused a little bit of stir with big tobacco and some lawyers, but there's the SJC actually settled an appeal last year that basically gave the authority to the local boards of health, which didn't violate law. But the intent tonight is just to give a primer to the boards on the concepts of nicotine-free generation. And then we're going to kind of just tackle that in the next Tri-Town meeting. So there's no decisions. It's really an educational session. And Maureen, the floor is yours.
Okay, Jim, thanks very much. And all of you, please, thank you for the time that you're providing to me tonight to share a little bit about what nicotine-free generation, or what we've been doing with nicotine-free generation in my area. I understand that from Jim that you're all experienced and knowledgeable, so I won't spend a lot of time on the health issues caused by nicotine use. We all know that smoking is the leading cause of preventable death, and that smoking is a financial burden to the smoker, as well as to our healthcare systems, a burden which trickles down to our local communities. What I do want to share with you is why so many communities are considering NFG. I've been doing tobacco prevention work for the last 14 years and worked on many tobacco policies, as Jim has: pharmacy ban, cigar minimum price, T21, flavor restriction, smoking bar ban, permit cap, and others, some of which have become state law. These are good policies that made sense, policies that have helped, and policies that have moved the needle a little. However, in spite of huge inroads, and we know that smoking has decreased, but people still smoke, millions are still affected by secondhand smoke, vaping in our schools remains a serious issue, and the tobacco industry continues to develop and market new, appealing, cheap, discreet, and high nicotine products. We now have vape pens that look just like highlighters, Bic-style pens that write and vape, a vape device with an LED screen to tell you how many puffs you have left that triggers you to go get another one. I bought a few devices last week, just before we went to the State House for our annual day with our legislators. One that I purchased looks just like a teddy bear. One looks like a little guitar. And one that looks like a CD has packaging that says, quote, vape and play music wirelessly from your pocket, end quote. How cool is that? And who do we think they're marketing to? Now we have these amazing little nicotine pouches, a product that packs a terrific punch. Well, a pack of cigarettes has between 22 and 24 milligrams of nicotine. These tiny pouches have 3, 6, 9, 16, 18 or more milligrams of nicotine, and they're very cheap. They're more discreet than vaping, and the high nicotine content makes it easier to become addicted. The industry would have us believe that these products are safer, that they help adult smokers quit or cut down on smoking, which would be great, and I hope it does help some people. But I don't believe these products are designed to attract adult smokers. The industry is losing smokers. They need replacement customers. These replacement customers are our young people, teenagers who don't smoke, who have never smoked. Young people experiment with these cool, cute, clever products, which may lead to lifelong addiction, which causes the many health problems that we all know about. It's a financial burden, can be a gateway to other substance use, and can even be an opportunity cost. Most young people do not know that if they use nicotine, they can't join the military, and they may not be. They may not be able to join the police or fire department. In today's environment, we don't want to decrease opportunities for future employment. AI may take away many jobs, but we will still need police, fire, and military personnel. And these jobs can be a good alternative to some of our young people who may not want to go to college at this point. How do we help our young people not to become addicted to nicotine in the face of the added stress that we all have, but especially young people have these days, and the onslaught of appealing products that are relentlessly peddled on social media that most of us don't see? Brains don't fully develop, as we know, until about age 25 or 26, making young people more susceptible to addiction. And once addicted, it's very hard to stop. People think that there's a choice once you're addicted. For a young brain, there is no choice. We all know that nicotine is one of the most, if not the most, addictive substances legally sold in the US. NFG is a brilliant solution. It's a policy with a long runway, which gives retailers time to plan for slight changes year after year, and it doesn't prevent those adults who use nicotine products from being able to purchase cigarettes, cigars, vapes, chew, pouches, or any other nicotine products currently available, with more always on the way. We can't keep up with big tobacco. Toothpicks dipped in nicotine? Yes, I've seen those also. It's pretty simple once you get used to the idea. We change tobacco sales from an age restricted product, and that's what we're used to, and as Jim said, to a birth date restricted product. For example, in many of the 16 communities that adopted NFG in the past year, the birth date restriction is that they chose is 1/1/2004. Anyone born before 1/1/2004 can still be sold tobacco products, but it would be illegal to sell tobacco products to anyone born on or after 1/1/2004. No one who's already 21 loses his or her privilege to purchase tobacco products. The policy only affects those who do not now and have never been able to legally buy nicotine products. It's, as I said, it's a slow rollout that allows retailers time to adjust to slightly lower tobacco sales over an extended period of time. Unlike the flavor ban that removed all flavored products from retailer shelves on day one. Jim mentioned that Brookline was sued. Brookline passed it, they called it TFG at the time, tobacco-free generation. We changed it to nicotine-free generation simply to make sure that everybody understood it covered all nicotine products, not just combustible tobacco. They were sued, and that lawsuit was appealed all the way to the Massachusetts Supreme Judicial Court. And not only did the court unanimously decide in favor of Brookline's right to have this type of policy, they also applauded local public health for leading the way in protecting our youth from the harms of tobacco use. Last March, immediately after the SJC decision, the Stoneham Board of Health, which I'm proud to say is in my area, became the first board of health in the world to adopt NFG. So Brookline did it as a bylaw. Stoneham became the first board of health, followed by Wakefield, and then Melrose, Malden, Winchester, Reading, Concord, Manchester, Chelsea, Belchertown, Needham, Newton, Pelham, and more recently, Somerville. In summary, I just want to remind everyone, retailers have a long time to get used to a slightly lower tobacco sales each year. Each year, just 1 year's worth of potential new buyers will not be able to legally buy tobacco products. No one has a privilege taken away. Those who are already of legal age to buy tobacco products can still continue to buy them. It's easy to administer. A sales clerk just has to look at the birth date on the ID. Either the purchaser was born before the cutoff date and can be sold a tobacco product, or they were born on or after the cutoff date and can't. Today, the legal age birth date changes every single day. Again, the highest court has decided the legality of the policy. And importantly, young people want this policy. This is for them and about them. They spoke eloquently about nicotine use at the State House just this past week. They talked to their legislators about what they see in schools, not being able to use a bathroom because people are vaping in it, how vaping especially affects attention in the classroom, and that they have friends who can't go through a 45 or 50-minute class without wanting to leave to go to the bathroom to vape. That's the addiction. The goal, as it was for smoke-free workplace law, is to have enough cities and towns adopt NFG that it becomes more likely to be adopted as a statewide law. An NFG bill was filed in both the Massachusetts State Senate and House in January, and it's critical to have more cities and towns adopt this policy. I hope you are among them. By the way, bills have been filed in both the Indiana and Nevada state legislatures, but I hope that Massachusetts is first, just as we were first with the statewide flavor ban. I'd like to close with a quote that resonated with me as I worked on NFG in my region. A longtime board chair, who was not always a fan of tobacco sales regulations, said, quote, "We do it for the kids." And that's the key. This is not about adult smokers. We're not taking anything away from adults. This is about protecting future generations from the financial health and opportunity costs of a lifetime of addiction. And again, thank you. And I'd be happy to take any questions. And also I do work with some subject matter experts, lawyers, public health people, doctors. So we have other people who can provide more information than I did tonight. We have materials we could send. If you haven't seen some of these products, I can send Jim some photos that I have of, a teddy bear vape or a little guitar vape, and he can share them with you.
Thanks, Maureen.
Thank you, Maureen. Would
Thank you.
anybody on the board like to ask questions, or Jim?
No, but I'd be happy for
Or
her
make
to send
comments?
any material. I'd
Pardon?
be happy for her to send any and all material if she can to Jim. We can.
Did you get that, Maureen?
Yeah, I mean, I'll be, yeah.
Jim, no follow up on it?
And again, the intent is to bring Maureen to Pittsfield Board of Health also introduced nicotine-free generation, and we're working with them. There's a lot of community input and conversations to be had. But I'm just, the intent is to bring Maureen, share her experience, a maverick on the eastern part of the state with these policies. And we're constantly playing whack-a-mole. And as I learn more about NFG in my 30 years experience of tobacco controls, like we're constantly playing this whack-a-mole. Like every couple of years, we're making this adjustment, making that adjustment. We're always trying to figure out, as new products come out, how to deal with that. And while we've made progress, there's still a lot of gaps in state law and in local law. And what's going on at the federal level with this massive uncertainty with the FDA, they just gutted the FDA tobacco program, which we haven't felt yet. But with all this uncertainty, with massive cuts, we're going to be left alone at the local level with or without grant resources to solve public health problems. And NFG is an interesting concept where you make the decision, you roll it out, and we hope that the new generation doesn't have lifetime addiction. So that's really where we're at right now. It's no decisions to be made. It's really to prime the pumping towards thinking about the concepts for the next quarterly meeting.
Thank you. Does anybody in the, oh, sorry. Eli.
Who's the most likely objective to doing this?
Well, probably
Other than
retailers.
the Tobacco companies.
Yeah, I mean, obviously retailers.
There is an argument, Now, for example, nicotine is a very addictive drug, and Maureen made a very good point about how this is being used to these techniques are used to induce children into it. And when you compare nicotine to, let's say, other addictive drugs like heroin or alcohol, when heroin and alcohol is abused, it leads to socially unacceptable behavior. Now, what I think, Maureen, is another advantage of your program that you're not really emphasizing that much is that actually smoking in many ways is socially unacceptable behavior. It's not just because people don't like to be around smoke, but I'm sure most of the people on the board here who have had the experience of working in hospitals, intensive care units, this leads to so much additional healthcare costs. And I mean, our society bears the burden. So this is socially unacceptable behavior in a very basic way. So that's.
Absolutely.
So who would object? Who would be, if we say we'd like to move ahead?
Well, the people that don't understand it, they think you're just trying to save the kids and,
Right.
let them do their thing and they should be able to do that. But it's really, there's a social repercussion to this that's never really pointed out, but it's huge.
It is huge. And so it seems such we already have some rules that are inconsistent around the state. But this seems like such a reasonable thing with a reasonable amount of time for retailers to get used to it. Are there legal implications that we don't know as a town that might impact us? Because the retailers, can they sue us? Is there a legal battle that might ensue? Because it seems if you give a year or two for people to get used to the idea and introduce it slowly, it seems like.
I can, if you would like, I can answer that, I think. Mark Gottlieb from Northeastern's Public Health Advocacy Institute in his department defended Brookline in that lawsuit that was brought against them when they passed NFG in 2020. And Mark has stated in every meeting I've ever been in with him, and that's many, that Northeastern Public Health Advocacy Institute will defend any municipality that adopts this regulation if there were to be any legal action, and we don't expect it, but they would defend the municipality pro bono as they did for Brookline.
That's good.
Wonderful.
Additionally, the SJC has already ruled on the appeal in favor of Brookline, so that sets precedent.
Yep.
Good.
Okay, does anybody in the audience like to comment on this or make a question? Patrick?
I think it's a wonderful proposal. I completely support it. I think that be prepared for the argument against it, which is freedom, freedom, whatever. I mean, I always thought it was weird that somebody might serve overseas in the military at 18 and couldn't buy a beer until they were 21. I just thought that was unfair to people in service. I'm not saying that they should or shouldn't, but that's the discrepancy that you're up against. And one question I would have for you is, I understand with this, basically you would, let's say you said in 2004, so you had to be 21, then next year you have to be 22, next year you have 23. Maybe a compromise, if you were looking for one, and I'm not suggesting you should have one, would be to say every year goes up 6 months. So that, people gotta wait a little longer every year, but if they think that they really gotta do it, you can make that argument for any vice, and that just might be some way to deal with the political issue of some people who might want to see a pushback. So
Yeah.
I think that if you leave it like the proposal is, I'm fine with it.
We're just starting the conversation.
Yeah, thank you, Patrick. Yeah, we look forward to getting all sorts of pushback and seeing what we can do to deal with it. Okay, so.
Thanks, Maureen.
Yes.
Thank you. Thank you all very much.
And you're going to follow up on those.
Absolutely, yeah.
The next item is Berkshire Regional Planning, Laura Kitros. The Berkshire Regional Planning agenda item is on here because about a few weeks ago, several weeks ago, Jim Willis brought to the attention of the chairs that he had some concerns about how the Tri-Town Health Department would function in certain emergency situations. I don't want to paraphrase you, Jim. So could you express to the board what those concerns
So I want to thank Laura for taking time out of her evening to come. So basically, we've been, in this early stages of planning for measles preparedness. Dr. Kennedy and I have met with High Lawn Farm on biosecurity measures and really seeing what's happening with the measles and the bird flu and everything else in between. And so kind of at the same time, BCBOHA had sent out an email asking the boards of health to conduct this emergency preparedness framework, and some other web EOC stuff that we can deal with the board. But as we started to look at that, I was getting a little confused because historically BRPC gets emergency preparedness funding. The boards aren't really knowledgeable and up to date to create this framework. And as I started looking at the framework, it starts asking a lot of questions on different types of plans. And so, back in 12 plus years ago, each town had its own plan. And I think it became regional at some point. And so I was having a really hard time understanding the plans in its current status. They seemed a little outdated. And at some point, the 3 tri-town towns were split up. And that's another topic of conversation. It's not that I'm for or against the split up. It's just so that in preparation with the chair, as we're setting the tri-town agenda, we're having a hard time understanding this framework. And so we started reaching out to Southern Berkshire REPC and the police chiefs and the fire chiefs and the select boards. And everyone was as confused, if not more confused than I was on where we are. And so we're trying to get an understanding on what role Tri-Town Health plays with emergency preparedness planning. Where are we? How do we move forward? And then I just gave that information to the chairs, and they have sort of their own questions. And we did attend the BCBOHA meeting, and I have a hard time connecting the dots. I'm not in this every day. So rather than give bad or wrong information to the boards, it's important just, have Laura here and help us kind of fill in the gaps and figure out, and look at we're very good at responding to emergencies. We responded to COVID. Berkshire Regional did an awesome job up at BCC, and, Fairview played a role in that. Times have changed. There's public health excellence. We have a Southern Berkshire program. We also want to be mindful with EMS on what their priorities are. But if we had to respond to an emergency tomorrow, we will be able to do it. We're working with measles. We're doing flu vaccines. Our collaborative responded to the wildfires. So it's not I don't want people to think the world's going to end tomorrow because we don't have an updated plan. But I think there's a lot of questions, and we have new board members, some have been around a while. We need to get an understanding on what we can do to get to a good place. So I'll turn it over to the board.
Okay, thank you, Jim. So Laura, the question that Jim actually posed to me is what is the role of the Tri-Town Health Department in the current emergency management plan?
So it's a good question, and I think it'll depend on the emergency and, what we're responding to. Jim's always been a partner in any response that we've had to any emergency, as have, other boards of health and other agents around the county. I think I want to take a step back, if that's all right. And I also just want to say that I will answer any questions I can tonight. I'm not in the thick of the details anymore. I have a good historical background, having done this for the last 18 years. But anything that's very specific that I can't answer, that my staff is working on now, I will get those responses for you if I can't answer it tonight. I should be able to answer everything, but you never know. So I think all right, let me start with, so you heard Jim mention Berkshire County Boards of Health Association and Berkshire Regional Planning Commission. Berkshire County Boards of Health Association actually is the Emergency Preparedness Coalition in Berkshire County. Berkshire Regional Planning Commission staffs BCBOHA and acts as the fiscal host for the emergency preparedness money. So I just want to make sure that we have those relationships They're very intertwined. I work for Berkshire Regional Planning Commission, but I also act as the director of BCBOHA. So we're very intertwined, but I just want to make sure that we have kind of that structure. The emergency preparedness money comes with a lot of strictures on it from the CDC. So it's federal money. It comes from the Centers for Disease Control. For those of you who don't know, it started in around 2002, 2003 in response somewhat to 9/11, but really more the anthrax attacks that followed 9/11, when there was a realization that public health might actually have a role to play in an emergency. And therefore, we should make sure that they're prepared to respond to an emergency. So that's when that money originally came. It comes from the CDC. I don't think it's authorized specifically by Congress. It's money that comes to the CDC and then they decide how to spend that money. And they've always decided to send, or always since 2003, a certain percentage of that to the states. All 50 states receive public health emergency preparedness money, as well as some larger cities like New York City receives their own money. They could decide in this environment that that's no longer how they choose to spend their money. Right now, we're proceeding and they're proceeding as though the money will be available next year. But I just want to put that caution out there that this money may or may, like a lot of money that's coming out of the federal government right now, may or may not be there starting July 1st. So they put a lot of conditions on that to the state, that it has to be sent on certain things. The state then puts additional conditions on the locals. So we don't always get to decide what we want to spend that money on and what we think the priorities are. We've always had enough leeway that we've been able to do what we thought was good for Berkshire County and to plan on a regional basis for Berkshire County, as well as meeting multitudes of deliverable reports and spreadsheets and so on that they want, like any other grant. That's becoming less and less true. So these frameworks, we've always been told since 2002 that this money had to be spent regionally, that we had to plan regionally, the money had to be spent regionally. In Massachusetts, as we all know, that's not how public health works, with the exception of some things like Tri-Town Health. So it's been a challenge in Massachusetts. All of a sudden this year, we are getting the directive that the towns have to be involved. And that this framework, that we had to produce some kind of framework that each town would fill out and then be part of their comprehensive emergency management plan. We did do a number of workshops where we invited people to come, and Diane, I think you were at least one of them. And we tried to explain this. Obviously, we didn't do a perfect job of explaining it and why that was the case. It's probably not a bad idea for the towns to be aware of what plans you do and don't have. This was never meant to be, look at this and tell us all the plans you've produced over the last 20 years, because we knew that public health had counted on us, counted on, you know, regional structures to have those plans. So there's been some bumps in the road, some growing pains with it. But I don't think it's a bad thing that the towns are starting to look like this. And, you know, we are certainly here to walk through and help any town with that framework, should that be a condition again next year, and or we want to. I think Jim was alluding to emergency dispensing site plans, which was the priority or a priority for many, many years, which was in response to the anthrax attacks, which were the initial impetus for this money, where they wanted to know that we were prepared to give a prophylaxis, in this case, doxycycline for an anthrax attack, within 72 hours to 100% of the population. So that's what we planned for. And over the years, we've had some opportunity to implement those EDS plans in real life and discover what actually worked and what didn't work. And what we've learned, especially from COVID, is that large regional sites work much better than small local sites. You just don't have the staff, the space. With COVID vaccines, we had to store it in, you know, sub-zero freezers. So that's why the plans have changed. And it's funny, when I was looking for stuff for this meeting, I found we actually were doing a tabletop exercise on the EDS sites on March 24th, 2020. I found a flyer that we must have sent out to everybody, and we must have canceled it. I didn't even remember that we were doing that tabletop. It's a very nice flyer. Would have been a great event, but obviously we didn't do it because the world had shut down a couple of weeks earlier.
Excuse me, Laura,
Yeah.
I.
Yeah, no,
appreciate
please.
You're giving us a little of the background here, but we have a busy night tonight. I'm sure you're busy too. We have a very specific question, okay? And actually, probably two parts to it. The first is how the Tri-Town Health Department functions in the current emergency management plan. Now, we know you've been receiving money for 20 years. You don't have to tell us that. I think you received $250,000 last year
Yeah.
to do emergency management preparedness and to coordinate that with the different towns. So what we're asking you very simply is, considering the fact you've received millions of dollars to do this for 20 years, what is the role of the Tri-Town Health Department in the current emergency management plan, which I assume you've coordinated with all the towns in the county since you've been doing it for so long?
So when you say current emergency management plan, what are you referring to?
I'm referring to the current emergency management plan. I assume that if you've been doing emergency management preparedness for, I'd like for, I don't know how many years, that you have a plan and that something has been put together using all of those funds
So
that allows for a coordinated activity. Now, Jim brought to our attention the fact that he didn't understand how the Tri-Town Health Department functioned in the current plan. So that's all we want you to explain to us, is how we function in that plan, so that this board is responsible for making sure that Tri-Town Health Department functions well. Of course, we have fire and police and emergency management, and there are other, there are multiple aspects of the same anticipated emergency response, and it would seem to me to be logical that there would be a coordinated some kind of coordination of these groups, considering how long Berkshire Regional Planning or this sub-part of it has been working on this. So what we're simply asking you to do is to describe for Jim's benefit, since he's the executive in charge of the Tri-Town Health Department, how does this department function in coordination with the other players, the police, the fire, emergency management, in case of an emergency, as a result of all of your work coordinating with the towns to put together an emergency management preparedness plan? What is it, and what is our role?
Laura, if I could maybe help, because I think there's a big disconnect on knowledge understanding, and that's why I was reluctant to do the framework, because I can't do a framework in good conscience by myself saying.
Oh, right, yeah.
And that's why I was asking a lot of questions, because like in my mind, I think about what Diane did 12 years ago, and I think Allison or someone helped facilitate all that. Diane did a lot of legwork, but BRPC was the backbone to support that. And then, at some point there was regional plans, and I know, like, I keep thinking old school, like EDS plans, but if Tri-Town has to, launch a regional plan, whether it's EDS or whatever, what do we, even countywide, northern, central, south, what's at our disposal so I can coordinate with Scott, the select boards, fire, police? Because at the end of the day, my job is to manage the department, staffing and whatever. And I don't understand what I got from you and Diane and what you shared with all these different plans, because some of it's out of date. There's debate on Lenox being central. And so, like, there's a little bit of anxiety surrounded about, as we plan for measles, do we have anything that we can hang our hats on so we can launch a plan? And I think that's where a lot of this confusion is. Many of us are in our minds thinking EDS, but like, what about bioterrorism, biosecurity? We're working with H5N1. If we have a plan that's a couple years old, that's something that's workable. But I want to be able to help BRPC facilitate talking to the select boards, talking to the police, talking to fire. And if Lennox wants to be central and south, we should incorporate that. If Lee wants to go central and south, we should incorporate that. There's just a total lack of breakdown and understanding. And we're not trying to put you on the spot, but like they're at boards or I report to that board, the boards are asking me and I don't have the answers.
No, and if people are confused and not understanding, so we have a variety of plans. Each town has a comprehensive emergency management plan. We've done a variety of public health related annexes over the years for that and asked the towns, and sometimes it's happened, sometimes it's not, to ask their EMDs to attach them as annexes. So for instance, the regional EDS plan, the big EDS plans that in the regional sites are probably 70 pages. The regional EDS plan is probably 3 pages. The framework, again, we were asking people to coordinate or to ask us to help coordinate with the EMDs to fill that out and then to attach it as an annex. So there's a variety of plans. And Jim's always been a leader. He's always been part of any of the plans that we have. A plan is only a plan. A plan is not a blueprint of exactly you're going to do this. The plan is what allows us to think ahead of time so that we're not reacting in the moment and to think ahead of time about what we should be doing. The role of Tri-Town is whatever Tri-Town has the time, the capacity, and the ability to do at the time of the emergency. We've always counted on Tri-Town to be part of those leadership groups during COVID, that just being the most recent one. We called together groups of the boards of health in the beginning to talk about how we were going to coordinate within the county on short-term rentals, on businesses, on all sorts of things. And again, I know Diane and Jim were both part of that. When we did the vaccines, Jim was part of that. And yes, we used the plans that we had been using over the years. We adapted them, we changed them. They were different. So I guess the role of Tri-Town is to be, because you're one of the bigger health departments, because you do have full-time staff that's capable and knows what they're doing and has the appropriate certifications and so on, and has some capacity, they're always going to be part of a leader in any emergency. Nobody is going to be assigned a role that they have to fulfill in the case of an emergency. That's just not the way emergency plans work. You never know who's going to be off visiting Florida that week, or.
Okay, well, I appreciate that. Now,
I'm not
Jim's.
sure I'm totally answering your question.
Okay, all right. Well, Jim had that question. Now, in exploring Jim's question, in my own homework, I came up with a different question, which I'm going to pose to you right now. This question has to do with the fact that we went to, in order to explore this a little further, a few weeks ago, we went to one of your executive committee meetings.
Yep.
Which I have to say I was disappointed to find wasn't recorded and isn't available to the public on any of the normal channels to review. And there were only a few towns there, even though the coalition supposedly represents, I think, 32 towns. So I was a little disappointed to see that. And I also then found that let me get to the question. We're being asked, apparently, or we're being in a position of somehow contributing to the concept of what's called concurrence. And as I understand the concurrence, what the concurrence means is that every year, Berkshire Regional Planning has this concurrence vote, which is the 5 members of your executive committee. And it happens after you solicit different kinds of information from boards of health that would contribute to this potentially, or serve some sort of a basis for agreeing to it. And that this happened, for example, last year, and you got $242,000 as a result of that.
240.
I'm sorry?
We didn't get $242,000, but okay.
I'm sorry. Well, that's what I understood, because I did a Freedom of Information search, and that's the figure that I got. Okay, I'll have to figure that out why it's wrong. The bottom line is that I couldn't find the minutes for the concurrence meeting last year or the recorded session, because there apparently
Minutes
isn't
should be
one.
on our website, and if they're not, I'll find out why they're not. The
Okay.
minutes should be on our website,
But the question I have for you is considering the fact that we're now being asked, or there's another concurrence meeting, I guess, next week.
the 16th.
Okay. Do you have any spreadsheets or anything that show how the funds were used, whatever that funding was last year, or the millions of dollars over the
Yeah,
last?
so we report, so let me explain what concurrence
And
is.
so, just to finish the question, since I haven't been able to figure out any of this information, I'm wondering how I could participate next week in an educated way to contribute to this concurrence. Do you simply make this decision unilaterally? It seems like that's what you do. And it seems to me that the funding is supposed to be for the towns, with Berkshire Regional Planning facilitating the funding going to the towns based on their needs for this emergency management preparedness, and putting this plan together that I don't think I understand what it is yet. But it seemed to me that Berkshire Regional Planning is making these decisions without them being open to public view. And I'm just going to suggest that, just from doing my own homework, it seems like a lot of people in our towns haven't had the experience of having you work with them on these plans or do anything. And I just would like to suggest to you that you make your process more open and more transparent, so that we can have.
Can I explain what concurrence is? Because I think there's a little bit of confusion about what concurrence is. Concurrence is a requirement of the State Department of Public Health from the CDC. What concurrence is the coalitions and their municipalities saying that we concur with the state's application to the CDC. It has nothing to do with the money they give us or how we get money or what we do with that money. The state must, as a requirement of their notice of funding opportunity with the CDC, say that they have solicited input from the coalitions. I thought there were 13. I think I was corrected. There's 14 or something, but the coalitions across the state. So it's not something that, it has nothing to do with what we end up doing with the money or how the money comes with us. It's us saying that we agree or don't agree, because we often don't agree as Berkshire County, with the state's process for both soliciting input from the locals, which is kind of ironic based on what you're saying, or that in the years when we've seen deliverables ahead of time, which are few and far between, that we agree with the deliverables that they're then going to place on the locals. So and as I think I said the other day, this is something we used to send it out to all the big BCBOHA lists. So everybody used to get, here's the piles of documentation that the state has given to us this year. Please look at that. If we don't hear back from your board, we're going to assume you're in concurrence. Then when they decided that it was all subject to open meeting law, we stopped being able to do that. But we send it out every year to everybody. Here's all this material. Please come if you'd like to come and give input at the executive committee meeting. And then the 5 executive committee members do make that vote on behalf of the towns, because that's how it has to be done with open meeting law. This year, we've gotten 3 pages. We normally get tons of pages, tons of stuff. Usually the state does a conference call, which we send out to everybody. Please join the conference call if you want to. There's no conference call this year. From what I understand is CDC sent them, they usually get about an 80-page notice of funding opportunity. And this year it was 5 pages. So I think this is not a typical year in terms of what information. We have the email ready to go to send out to people about next week's meeting. I didn't get it out today. It should have gone out today, a week ahead. It will go out tomorrow. But again, all I have is basically 1 page of these are the priorities for budget period 2, which is fiscal 26.
All right, well, thank you. Does anybody else have any other questions or comments? Bob?
Yeah, I do. So Concurrence, maybe it's best for me to ask in a way what it's not. It's not Lee Board of Health delegating to the Berkshire Boards of Health Association the ability to say yes or no to money coming to the Board of Health. It's a concurrence with the state to accept CDC money, to be aware and cooperate with planning, to have, depends on what's in those 80 or now 5 pages.
Right.
Okay, but it's not money that was earmarked for a local city or town that then we delegate the executive committee to accept on our behalf.
Yes, but so most.
So it is that.
Most years they have told us how they will distribute the money. Most years they know how much money they're going to get by this point in the process, and they have told us that.
Yeah.
So that is a small piece of it. But what we've been told over the years is what they put in their response to the notice of funding opportunity to CDC is not the point. The point is, did we agree with the process?
Okay.
That's changed over the years, and any given year they might say something slightly different. This year it's definitely the process, since we have no idea what's going to be in it.
I would just want to state that the part I would, as a Board of Health member,
Yep.
would be interested in knowing and being a part of is if that money, if there's some assumption in the scheme of things that that money was earmarked for my city or town.
Yep.
And I had delegated to the executive committee. I've never done that. I've
Right, so
never
there's no-
been aware of that.
So there's no
And I
money
would-
that's earmarked for any municipality. The money has to be distributed regionally. That's part of the
Okay,
requirement. So it's for Berkshire County. We should
Okay.
make sure that we're benefiting and that,
Yeah,
all towns, the executive committee is voted on by the membership. You're all members, whether you like it or not. At the fall dinner.
okay.
You're more than welcome to attend that. If
Sure.
you don't want to pay for the dinner, you're more than welcome to come for the speaker and for the voting and the
Yeah.
election without paying for the dinner.
There may be, I'm assuming, because it's within me, just that small uncertainty, uncomfortability of being like usurped kind of thing, that the
Yep, yep.
decision was, and I'm reassured about that.
Okay.
I have a more concrete question, and that's that you mentioned a couple of times is a framework.
Yeah.
Is the framework exist like a organizational chart, or is it a listing or a database or
It's a
a?
listing. So this was created in response to a deliverable from DPH this year by the 4 counties of Western Mass. We almost always work with the other 3 counties on Western Mass on these bigger deliverables to make sure that we're consistent not only across the county, but
Same
across.
software, same, yeah.
Well, and that we're basically, our plans look similar and that are, because in a big emergency, we're all
So
going
it's
to be
a
dependent on
list
each other.
of-
So it's essentially a list with drop downs.
Okay,
And
and the headings on that list might be a Board of Health, it might be a emergency management staff, like the
yeah, so it's basically who in your town does this function in an emergency.
okay,
So it is something you have to work with.
Okay.
It's something you have to work with
It's a-
your emergency
it's a
management. director
database,
on.
yeah.
Probably your select board, this first round of filling them out, it's just getting everybody kind of used to the idea that these are
And that's the
functions.
web EOC.
No, WebEOC is something completely different.
But that's like that too, in some ways. I don't mean to.
No.
You can say no and move on. I don't mean to open it.
No, I want to explain these things because I'd rather that people knew. I mean, obviously.
'Cause that seems like
Job
that.
of reaching,
Yeah,
So WebEOC is a communication platform that DPH will use in an
Okay.
emergency directly with the boards of health. And in fact, despite the fact that everything was supposed to be done regionally for years, they would never give us access to it. So we now have read access finally after
Okay.
10 or 15 years. And for years and years and years, we updated quarterly a 24/7 contact list. So I would make sure that I had the updated contact list from all of you. It's something I continued to do until the last couple of years myself, did not delegate it. That we had a contact list. We sent it to the HMCC, who sent it to DPH. I'm sorry for all the acronyms. Every quarter. They are now saying that I can no longer collect that information from the towns, which I also use for the BCBOHA communications, that the towns have to go into Web EOC themselves and update this. And we said, fine, we'll just get the passwords from the towns and we'll do it
Sounds
ourselves.
like there's a lot of overlap between that and the framework. The same people.
It's the same people asking you to do both.
No, and it's many of the same people must be the end communicant. You know,
Yes, in some.
or it's just,
For
as Web
tribes,
EOC
that will
might
be
just,
true. It may be less
Yeah.
true in some of the smaller towns. that don't
yeah.
have-
I mean, some of my problem is I mixed up some of these two issues.
So a couple of things, the Web EOC, like, I've never suggested that BRPC do our Web EOC login stuff, like, I just think, I have a couple of points, it's just, I just think there's a lot of confusion the way some of these emails come out. You know, BCBOHA sends out emails and we don't know who sends them, because then when we hit reply, we don't actually know, I don't know if it's you, Julia, or someone else.
Could be.
So like,
It could be.
one of my fundamental
I tried to sign.
problems is an email comes out, it says you are now, boards of health are now required to do Web EOC. I don't care about that. I can help the chairs log in when we get new board members. I don't care about that. I don't want anyone else to do our board of health contact information other than me in the chairs, and we get new elections and stuff like that. But I still have a fundamental problem with this framework, because I want to be able to reference other plans that I don't have access to that aren't updated. I cannot endorse me sitting in a room by myself issuing off check marks on things that I don't know, I'm not knowledgeable of. But now I have to take my time to coordinate with the police chiefs, the fire chiefs, emergency management directors. I have to coordinate all this stuff that's brand new to me that we necessarily don't have the time or resources to do.
That is in the framework?
That we're being asked, and I think where some of the confusion, Laura, comes from, and I'm only speaking for myself, is like, sometimes these emails come out and they feel like unfunded mandates. You
don't
shall,
disagree.
you shall log into, but it's not coming from DPH, it's coming from BCBOHA. You shall log into Web EOC,
But
you shall do this. And then we meet with FERCog, and they contradicted that email and said, well, technically speaking, you're not required to do this. And so like,
That's not what they.
when we have an organization getting funding, we should all be working together to stay on top of the stuff. And this shouldn't be, you know, a new board member comes and goes. I understand that. We can catch them up to speed. But like, fundamentally speaking, I've spoken to every leader in the Tri-Town district and nobody has a clue about any plans. And so like, we need to figure out how to get back on track. You know, and I know priorities shift, but like, if I need to facilitate figuring out our own Tri-Town plan and spend 100 hours doing it with no funds, I'll do it. But like, the fundamental problem is like, similar to like, we get tobacco control funding and we have a work plan and deliverables and we support the boards of health. And there's measurable things that come out of that. Just, I think a lot of us just don't understand. We get emails that now they feel like unfunded mandates, but I can't just give a framework to this board of health and say, here you go, guys, figure it out, because they're going to come to me and say,
Yeah.
what is this?
So what you didn't see with the framework is us fighting with DPH for months, that this was exactly how the boards of health were going to feel when they got that. And arguing that it was not.
And other towns are voicing concerns within our Southern Berkshire Collaborative
Absolutely.
as well.
And we absolutely told DPH this was going to be a problem and that this wasn't the way we did things in Berkshire County and that it was going to be an issue. Putting that aside, because on some level, we have to do what the contract says that we'll do. Putting that aside, we are obviously happy to come and help facilitate or just to meet with you, explain the various things, what plans do exist, what plans need to
I
be
think that's gonna be
updated.
really important and I'd be
So, you
willing.
know, again, anytime you want to reach out and,
I think it's, well, it also too, like, and I ain't gonna tell you how to run your meetings, but like all our meetings are videotaped, they're on public access. Having more availability on some of the routine goings on, you might get more than 6 towns to show up to your meetings. You have very little, so if this board has been doing tons of homework lately, it's really hard to figure out like some of the things that have been going on. And so there's some challenges
so
there.
again, I think over the years, I have always gone to any Board of Health that's asked. We've worked with boards of health that have asked. Traditionally, Tri-Town has not asked us to come.
Well, we don't know what the ask is. That's where the disconnect's coming from.
And yeah, and I mean, basically all we can. Huh?
Uh-oh.
Is that John?
Yeah, John didn't have a problem.
If there's someone, is there a board member that wants to speak? If not, we're going to hold our comments till later. So I think there's confusion on the ask, right?
Right,
If I
so-
know you have a planner
So
that's facilitating,
moving
I would be contacting that planner and say, can you come to Tri-Town?
Absolutely.
I will bring our chiefs and fire department. Can you help us inventory what we got and where our gaps were? I am more than willing to facilitate Scott and the fire chiefs and the police chiefs and EMD directors. I'd be more than happy to do that. But I just think there was like an assumption all of this stuff was going on. But then when I communicate with our towns, no one really has an understanding about anything. And that's why there's such a gap in communication. In like, if an email came out and said, kind of framing up like everything that you're trying to fight for us for, rather than, oh, by the way, you have an unfunded mandate. The
Yeah,
boards of health get that, I get
my
phone
head taken
calls.
off when I tried
And they're
to
like,
say
what the hell is
something very
this?
mild.
And so, but some of the delivery of communication, I think could be better done because it causes more questions and more confusion.
So again, I think I'm sorry. Jen.
Is there, again, a little bit of a basic, is there, for instance, a plan then? You're mentioning some plans available and how this framework might work. Is there a plan available, for instance, let's pick one that might happen, a terrible, devastating hurricane?
Mhm.
Is there a framework, or is that framework usable in that setting? I mean, there would be some public health factors within that, whether it was people's medication or
Yep.
the ability to have functioning
Hospital.
sewer and water treatment, et cetera. Is there a plan, at least roughly outlined?
So most natural disasters are done under, and Scott, correct me when I get the stuff wrong. Yeah, Scott's doing those for Stockbridge, for instance. So it's going to be hazard mitigation and municipal vulnerability plans. We certainly have input sometimes on those, sometimes we don't. That's up to
So
the individual municipality.
Is there a kind of like outline of a plan? for
So
that?
we've done pandemic plans, we've done family reunification plans, we were very involved in the regional sheltering plans, mass fatality plans, which desperately need updating. We were just talking about this at the Central Regional Emergency Planning Commission, the committee this morning. EDS plans, obviously, because that's where we always plan.
So those are the kind of nuts and bolts.
Right,
that we
working
would-
with municipality.
we would be
working with
interested.
municipal on continuity of operations plans, which again, and then the big one that we for years wanted to work on and which we've tended not to get a lot of support from DPH on working on is joint information and risk communication plans. We've flown by the seat of our pants usually when we've been doing risk communications. Both COVID and now with measles, with H5N1. We've really wanted to take the time and do that. And that's one of the ones we've been really stymied over the years on having a really comprehensive plan. We have one, but it's not as comprehensive as it should be. So I would love support from some of the boards of health who are more engaged and who know more what we're talking about, to say, yes, we do need a joint information plan. We do need to know how we're going to do both information sharing and risk communications in an emergency. And, again, we've done that. We've done it successfully, but if we had a plan ahead of time, it wouldn't depend on Jim being here or me being here or somebody being here who knows.
Yeah, from a perspective of a longstanding Board of Health member who's a volunteer, I would be interested in having confidence that at least outlines of plans for various scenarios exist, that the right people are listed in this framework or database, and that there was opportunity to understand significant updates to those plans so I could factor in how my role as a Board of Health member would play into those. And it might have some of my individual expertise, just like, as an educator, her contribution might be within that realm, as another Board of Health member in Lee is a nursing professional, and that would have, and so a wealth of opportunity would exist for input potentially, but the general piece from a, not fiduciary, from a kind of like town government standpoint, is I would want to know that these outlines for action exist in one form or another. Sure, one's going to be 20 years old and we need to update that, and it will be a rolling flow of that kind of thing. Situations change, funding will change. But that's, I think, where I would suggest
So
we start together.
I'm happy to
I'd
come.
love to know what the plans look like, or, how that exists. And then as a second part of that, move forward with more involvement, or at least pipeline. And some of it's the communication, and communication is, how the emails communicate or how other bulletins are addressed. And some is recording of past, but those are tangential issues to my key need. And that is, these plans and outlines exist in one form or another that can be adopted, and input can be provided as they need to evolve from a Board of Health member's perspective. Does that make sense?
Absolutely. And, we have always been available and wanting to come to the boards of health. Things during COVID, obviously, we didn't come, and then the boards of health are just starting to meet in person again and so on. It's no longer going to be me probably for most of those nitty gritty, like let's actually look at a plan. But we are more than happy to come anytime. It used to be much better about going out to the boards of health on a regular basis. We all got used to Zoom, not going out to things over COVID. But it seems like if Tri-Town wants to be involved, we would love to have you involved.
We wanna know.
Love to have your input, because I think that as a larger functioning, well-resourced health department, it's really important to have your input and make sure that you're comfortable with the way things will play out. And again, we keep getting thrown curveballs with our emergencies. They're not what we expect them to be. But if you have a basic plan, you can adapt it. And you know who to talk to. And that's the main thing that we need.
Thank you, Bob. Thank you. Any other comments or questions? Any comments or questions from the audience? Bob?
Hi, I'm Bob Jones. I'm on the Lee Select Board, which of course Tri-Town serves the league as well. And I was very interested in coming to this meeting because I actually stopped down and spoke with our fire chief, Ryan Brown, who's also heads up our EMS people. And I asked him about emergency management. Let me back it up a little bit. I first went to see Ryan Brown when I was concerned about the river with the PCBs and flooding and that sort of thing. And I said, what do we do if there's a hurricane? Is there an emergency management plan? Because that would involve fire, police, mutual aid, boards of health, it affects the water supply, that sort of thing. And Ryan said, well, there's some old plan, I don't know if it's 15 or 20 years old. And he said, I don't even know where it is, it's somewhere around here. But basically, well, how do we deal with emergency management? Well, we have mutual aid. And he explained to me, he has contact with not only his staff, but with state and regional and county, all the way up to federal on his walkie-talkie. So that's our emergency management plan. And he's never spoken to anybody from Berkshire Regional Planning. So it's not discussed with at least our fire department. I don't know, our chief is away right now, our police chief is away. I don't know if they've ever discussed emergency management with the police or not. And when I offer you this, I offer this to you only as factual information, because I don't understand, quite frankly, how Berkshire Regional Planning or any other entity can make up an emergency management plan without talking to boards of health.
So again, I'm only doing public health emergency preparedness plan. I would not be involved, nor would anybody at Berkshire Regional Planning Commission in your comprehensive emergency management plan, which I understand should be updated yearly, which would be 99% of the response to a hurricane. That's done on a local level. I suggest anybody who's interested in emergency planning more broadly, not related just to public health, your regional emergency planning committees, there's a central, a south, and a north one. They meet monthly. That's the place to go and talk about more broadly emergency management or emergency response and emergency preparedness with your first responders. I believe Lee is involved in the central RAPC. I have attended it for many years and have, I know most of the other towns. I will admit, I don't know Lee well, and I don't know if it's just that somehow I've never known who that person was that was sitting there, or I don't know the emergency management people. But as far as a hurricane goes, that wouldn't be within the public health emergency preparedness budget.
Or a pandemic or.
Pandemic, absolutely.
Yeah. Okay, but I don't think that, well, I guess what I'm saying, I'm sort of trying to echo what's been said at the table tonight. And that is, I think, from my perspective, very, very poor communication as to resources that are available. Berkshire Regional Planning's involvement on a more
Personal level.
more active, a more active role in individual towns planning for things like this. I mean, I'm basically, I don't really understand Berkshire Regional Planning, and I'm not criticizing you. I'm just telling you, I just don't get it. Because basically we're taking care of a lot of this stuff ourselves, and we've got a great lead board of health in Tri-Town. It's absolutely terrific. They saw us through the COVID scare, and but I just don't understand Berkshire Regional Planning's role. You're receiving funding that I don't know where that, if it's, I don't know how much it is. If it was $200,000 a year for the last 20 some odd years, we're talking about $3, $4, $5 million, and I don't understand how that funding is used, how it translates into service to the towns. I'll leave it at that. And it's more my ignorance than anything else, but I was hoping to be enlightened in some.
Okay, any other questions?
Yeah, I guess my observation is just, it seems to me that from earlier in the meeting, when you were talking about the various zones in the county, there's a lot of potential disasters that overlap public health. A hurricane, for example, could take out Pittsfield Sewer and Processing Station, which goes all the way downstream. You add that into a flood situation, and Stockbridge's sewer treatment plant is also in the floodplain. So there's certainly an implication of raw sewage getting into those areas. I think that my question is really around I'm not sure that the idea of like these kind of, okay, that's south, that's mid, that's north, necessarily works. For example, one potential disaster that could absolutely affect public health would be an incident, let's just call it that, at Tanglewood, that's shared by Lenox and Stockbridge, okay? That could have, there could be, who knows what kind of incident it might be, but some of them might involve people's health. And I don't want to see Lenox carved off into the north, because I want to make sure that Lenox and Lee and Stockbridge, whether we're in a PCB issue or a dam failure while they're cleaning up PCBs, or a situation where there was an incident and our towns need to work together. I think that, the other thing I would really consider is what are the transportation corridors, all right, between West Stockbridge, Lee, Beckett, Otis, Stockbridge. We've got 20,000 cars and about 1,000 tractor trailers coming in on Route 90 every single day into the Berkshires. All right, we've seen what happens when something flips over. We see it on the news nationally all the time. We've seen rail accidents that have unbelievably caustic chemicals. What happens? And I would just conclude with, I've been on the select board for 5 years. I've never seen any communication indicating to the normal individual what they should do if they encounter some of these kind of specific disasters. And I realize they're low probability, but maybe part of this could be just sort of providing people with comfort that, if this is what's going to happen in the case of emergency, you'll get a call, you get this information, you should shelter in place, you should get the hell out. I don't know what the answer is. I'm not a public health guy, but
So again, there's public health components to the disasters you're talking about, and I would hope that we would be consulted and be part of those. We would not be the lead on any of those emergencies.
You're saying that 32 towns, it's up to 32 tiny towns that have 15 employees or 5 employees each, come up with their own plans for all of this?
Massachusetts. No, I mean,
That's a little bit flippant.
but that's the regional emergency preparedness committees. They have mass evacuation plans. The sheriff's office has the ability to call most households in the county to let them know where they should go, what they should do.
Yeah.
All I'm saying is that while to some extent those plans are not.
Where are those plans?
Yeah, can we get
Plans, where are they? Like, who sees them?
So again, Scott, help me out here.
So every town, going back to Dr. Weisberger's question earlier, every town is required to have a comprehensive emergency management plan, updated yearly-ish. That basically gives you the general guidelines, mainly involving preparation and response in an emergency. It doesn't go into specific emergencies under this SEM plan. If you ever saw the old days, the old SEM plan, that was about that thick of a binder, made a great doorstop. Everything's digital now, and all ours are also on web EOC, easily accessible. I have 10.
Note that his web EOC is different than our web EOC.
Exactly. I can't see the public health web EOC. You guys can see my town EOC. Not for good reason.
God forbid.
Emergency Operations Center. It's a web-based that you can put documents and put in requests and.
Okay, well, Laura, I want to thank you for having come tonight. I think we've gone through this enough right now. I think we can close it up, but I do want to sort of note, unless somebody else on the board wants to say something else, that we have, I think, agreed that there's confusion, that there's lack of communication, that we don't understand what's going on completely, and that needs to be changed. And next week, our boards are invited to a concurrence meeting by you. And
Anybody is always welcome. At the
right, yes, well, the point, all that we want to do is have an emergency management plan that everybody feels confident with, and that doesn't give us contact numbers from people that aren't here anymore.
Right.
And when you look at the ideas of confusion, lack of communication, and executive meetings that, and this rubs me the wrong way, that aren't recorded, that aren't available to the public, I don't see how you can have really good communication. So I would encourage you at next week's concurrence meeting, which we've been invited to have it recorded and put it on CTSB TV so we can all see it, and so we can begin to work together to change the confusion, to change the lack of communication, and to do a good job for our communities in having a well-coordinated emergency management plan that involves the boards of health and the fire and police and emergency management. That's all. We just want to have better
I
communication.
will take everything you've said under advisement, and I would just ask that when we send out emails, that people read them and let me know, because I send out emails with a lot of information and I get people dropping off the list. I send out emails with less information. It's a very fine line. We try to send out emails. I get deafening silence back from 90.
People are not email addresses. You receive a lot of money. I don't know what it is exactly to do this. You should come to each town at least once a year, explain to us what you did the year before and what you intend to do this next year, that you want us to do this concurrence meeting. If we don't have any input into the concurrence meeting, that's one idea, but you're inviting us to go there. I'd like to know why and what I'm doing there. That's all. I mean, I don't have any idea. So this is what we want: a well-coordinated emergency management plan, less confusion, better communication, and I believe strongly that that comes from more transparency and accountability of your meetings so that we can all participate, even if we couldn't get there that time. Thank you.
Thank you.
Thank you. Who is the one that
Okay, so now the next item on the agenda is tobacco regulation edits and changes.
So folks, I do have a draft set of edits and changes that I think I would like to really dive into at the next quarterly meeting. It's heavy, but it incorporates the introduction to nicotine-free generation. One of the topics that have come up before is, we're getting less and less permit holders, and we don't have a retirement of those number of permits available in our towns. So Pittsfield and all our bordering towns have a retirement clause where if one store closes, that permit gets returned, and we slowly over time reduce the number of permits. Stockbridge only has two permit holders now. I think Lee has 11 and maybe has like 6 or 7. And so what I sent it electronically, and thank you, Elias, for letting me know that I had some grammatical edit carryovers in some of them. And so it's a heavy document, but I would like to take the next meeting that's not as packed to really dive a little bit deeper into this. The nicotine-free generation is a conversation I think that's going to take a while to sort through, but the oral nicotine pouches is an imminent issue that we need to address in some other edits, such as the permit capping. The state law doesn't allow flavored nicotine, but what's happening is the industry keeps putting out new products. This is called, it's called Zin, but it's one of many products out there that is made up of salts, flavor if you Google this product, it gives you a list of ingredients that says sweeteners and flavor enhancers, which is a ban by state law. And so these come in different strengths and is one of the top selling products with our young people. And I think we need to regulate this.
A certain age to go in and
Well,
purchase.
you're supposed to be 21, but all the kids are getting their hands on it. So there's some edits that, we're on pace to meet either June or July before end of summer.
Yeah.
And I would like the board members to, take a look at the regulations, look at some of the nicotine-free generation stuff, and then really spend the next meeting diving into this with hopes to have a hearing in the fall.
Okay.
Unless there's specific questions, I can just move on to number 6 if Mr. Chair would let me.
Go ahead, Jim.
So H5N1 measles update. So I have some information. So we've been in communication with Highland Farm. We've reached out to them. Dr. Kenny and I had a very good meeting with the manager and assistant manager. They're already thinking ahead of biosecurity measures, and we've offered our support from the Board of Health level to help them, prepare themselves for like H5N1 and the bird flu. And they're really, I was quite impressed. And I don't know what Dr. Kenny's sentiments are, but like they came in, they're hardworking, they put a lot of hours in, but they're really thinking far ahead of biosecurity and they're doing a really good job with that. And we offered some resources to them, access to some grants and stuff in preparation of that. Measles, through the collaborative in Tri-Town, Jane Smith, our manager, held a pretty comprehensive Zoom meeting last week with many stakeholders, schools, administrators, nurses, Berkshire Health Systems were at that table. We had some board members, school nurses, health inspectors, and Dr. Chang, who is on the Board of Health in Great Barrington alongside Jane, really brought many people together to start thinking about educational efforts, outreach. Dr. Kenny, who's our medical director, we have standing orders to provide measles vaccines to children and even adults. And Jane's reaching out to the schools. There are some schools that have lower vaccinations rates. And so we're really trying to put our heads together to do a good communication outreach and offer as many resources as we can to our community to not only educate folks, but get access to vaccinations. And so we're thinking about that. And this is why it's so important to have good preparedness plans comprehensively. So we get measles. It's not if, I think it's when we can appropriately respond, and which we will. But having everyone on the same playing field and understanding and how we navigate all our resources, I think is really important. Elias?
Yeah. I didn't hear religious groups.
Yes.
Because
So
religious groups typically can be
yes.
no, are they
Yeah, that's-
isolated, but they don't approve of that.
Yeah. So it's some of the data that we have that shows under vaccination rates, religious exemptions play a role in that. So, obviously this is not a mandate or, we're trying our best to educate, link people to resources, try to get people educated in hopes we can maybe get some of those vaccination rates up. And so we're doing a really good job, coordinating outreach and so on and so forth. Our Tri-Town site in the Southern Berkshire collaborative website has tons of information about measles, bird flu, and we're really, I think we're doing a fantastic job bringing all the right people together. I think there's over 60 people on this Zoom call, and I think people are they're hungry for information on what they can do as their own community member and how they can, participate to kind of work on these kind of efforts.
Well, my issue is only understanding populations that we know aren't getting vaccinated. It's great to have all the information getting out so people who need it and want it can get it. But are there pockets of people who won't come forward, who won't be vaccinated, who will then be in our community, but we won't even know it because they haven't sought information because that's not what they want.
Yeah, we'll never truly know. I mean, we are getting into the summer season. We have second homeowners, people all over the country. And I think we have a pretty good idea on at least in the schools, the private and public schools, where the low vaccination rates are. And we are emphasizing outreach and education efforts on that. But I don't think we'll fully know exactly because it's such a transient population. And this is why preparation and being prepared is really important.
I know the Hasidic population.
Yeah.
Some are up here and they're not good vaccinators. So will they be bringing kids in who'll be using our resources, but we won't even know that they may be spreading because they don't vaccinate. And that's just one religious group I'm familiar with. There's a Mennonite population. I do not know about how they feel. But I do know the Hasidic population is a big problem down in Nyack and in Brooklyn. It's not that they lack the information, but should we know that
It
the
will be
population?
very difficult to know.
Yeah.
Say again?
It will be very difficult, if not impossible, to know
Right,
with high degree of certainty.
and their population,
Taxes where,
and they're gonna use all our resources. And
because even the reporting from schools is required only if you have 30 or more people in your school school.
Yeah.
And so that means a lot of small schools and a lot of homeschooling settings
Yeah.
are not required to report. And I think that's actually the problem with one of our schools, that they have a low reporting rate, but they don't have,
High
they're not
incidence.
mandatory to report. And so anyway, your point is well taken, but it's going to be, we have to just be ready for that. In a way,
Right.
you know, we wished in COVID, everybody got the vaccine. We know they didn't. We dealt with that.
Because enough people
Got really sick,
And it's.
right? That may be what happens sometimes.
Yes.
And we're getting information out to the camps as camp season winds up
I
and
was on this call. I was impressed with the outreach in a science-based but gentle way to pockets that are known. So for instance, the availability of a kind, intelligent nurse, one-on-one or one-on-two with a parent is there. And I was very impressed with that. The language and the handouts, the literature is not get measles or you're ostracized.
Right.
It's, here's why this is important. It's like empathetically driven. And it was really, I was impressed with this meeting and with some of the tools they're using.
This is good. And that's why I said religious leaders, because sometimes they have an entree and they can be gentle, empathic, as well as culturally understanding
Yeah.
of some of the resistance.
And pray for us if it all goes well.
Getting them on our side, right?
any other questions on, H5N1 measles updates? We're doing a lot, so. Okay. Quickly, we're, through the collaborative in Tri-Town, we're working on trying to get Sharps collection kiosks in all our towns. With Tri-Town moving to Stockbridge, we have one in Stockbridge. Diane's working hard in Lenox.
Yep.
I think we got one going into Curtis.
Yep.
One thing, Bob, I think we should talk about with Lee is see what opportunities we can get a kiosk into Lee. The collaborative will pay for it through the grant and for the collection in the vendor.
Pill collection in the police.
Yeah, it's two different animals because the prescription thing is a heavily regulated, has to be placed in the police department situation where Sharps, we're just trying to collect Sharps and keep them out of the solid waste stream. So I know I'll circle back with Jane, but if we start running into some snags, we maybe lean on the Lee Board of Health to maybe help us advocate for that. So I think it's really important.
Jim, what is happening on Friday here?
Oh, so Friday's our quarterly Southern Berkshire Public Health Collaborative meeting. Dr. Westpfizer is our Lee delegate. Diane's actually the chair. And Lennox and, we could always look for someone in Stockbridge, but I've been kind of pinch hitting the Stockbridge one. But that's our routine governing board collaborative meeting, which is recorded. All our meetings are online and, and so that's the shared services group that we're really hitting on all cylinders these days on, our comprehensive vaccine program, our, home program. We doubled our COVID shots. We got measles now in our inventory and we're doing a really good job. So anyone's more than willing to attend those meetings. It's here, 9 a.m. and you can go on hybrid and our meetings are recorded. We launched the South County Resource Guide, which is a comprehensive guide that with Jane and Rania Markham and for families like ours work together to build a very comprehensive, it's an electronic version and printed copy of many, many, many resources dedicated for South County.
I know Lennox put it on their, it went out to all people that live in town. I don't know if you got an email on it, but if you're on their email list for the town, it went out. As soon as I
Yeah.
brought it into Carrie, she just forwarded it out.
Yeah, everyone loves it. It's we can just keep adding to it over time. And obviously we have tabled items. If we don't want to if we want to bring up anything from 11, 12 or 13, we need to have a motion and move it up to the active agenda. If not, we can move to citizen speak time. It's up to the board if they want to make a motion. If there's any other updates, right now it's just tabled.
Anybody want to entertain a motion for one of the table items?
How about make a motion for 11, 12, and 13 to table and
Go to
do it.
table, okay, you, table, Joanna's making a motion to table.
Right. Table them till the future.
They're already tabled.
Until next time. We'll skip them.
But I will meet with, we have a Lenox meeting tomorrow. We got to coordinate a Stockbridge meeting. We got to coordinate a lead meeting, and we can bring up those items as well in the very short future.
Table them until our individual meetings.
Do we have any citizens that want to speak?
I think everyone left. John and Carissa, do you have anything to add? I know we're just kind of moving along.
Yeah, I mean, I could speak as a board member and say that this was an excellent meeting, and I'm sorry I couldn't be there in person. But no, I have nothing to add. No, I'm good. Thank you.
Carissa, anything?
No, I have nothing to add, and I'm also sorry I couldn't be there in person, but thank you.
All right. All right.
Okay.
Okay, if there's nothing else to discuss, I'd like to have a motion to adjourn the
I make a
meeting.
motion, we adjourn this meeting.
John, Carissa, you in agreement for adjournment?
In agreement.
So moved. Have a good night.
Good night.
All right.